Bill, review with me for a moment. If you're a military anesthesiologist and there's an alleged bad outcome, and someone wants to bring a lawsuit, now it's difficult. It's hard to sue a military doctor. Are you talking about like dependents of patients? Or?
The lawsuits cannot involve a physician, military physician suing the Army, or any nurse or anybody. But dependents and retirees can and do and have sued the government.
I see.
And our role in the Department of Legal Medicine, in addition to preventive work, getting out in the field and telling people what not to do and what to do, was talking with the Army Judge Advocate General Corps members, called JAGs, and reviewing their cases. In general, if we found a case had merit, it would be settled. And the lawyers on the other side knew that, and they had a relatively easy time, because they knew that if they went to trial, they wouldn't get these massive verdicts, but we would make reasonable settlements. And they also knew that if they didn't have a case, they might as well give up. And it was a very interesting job, and I can honestly state that the care in the military was of high quality.
Yeah. Bill, there's a recurring theme here. You're talking about safety over and over again in your career, and as I look at the chapters and the papers and the presentations, you dealt with safety and the airway and electricity and fire all the time. That certainly was a primary part of your career.
The fascinating thing was 30 years that I spent chairing up to 4 committees. Sometimes I had more than one committee. I became very, very safety conscious, to the point that I drive my daughter and my son and my present wife up a tree sometimes talking about safety.
Okay.
But the interesting thing was that when Frances was alive, she used to go to the meetings with me and got to know some of the gals and the wives of the other, and she went right along with me with my thinking.
Well, Bill, if you wanted to be remembered by one thing that you've contributed to the anesthesiology profession, what would that involve?
I guess it would really involve a high degree of quality of care and practicing good habits and safe practices.
And we're very involved in that now in 2005, but you were way ahead of your time. Bill, tell us what you did after you retired from the Armed Forces Institute of Pathology.
Actually, I had been accepted for a position high up in the Veterans Administration central office as a law medicine problem reviewer. The difficulty was that at that time administrations were changing, and Bush was taking over from, I guess, from Reagan, and they were short of money, and they had announced that they were planning to create a cabinet position for the chief of the Veterans Administration. And the hierarchy at the VA decided that until they had this position filled, they weren't going to hire somebody at that high level and cost, so they never filled the position. My years working and having fun with railroad equipment suggested, and Betty, my wife, suggested that I go to and volunteer at the B&O Railroad Museum in Baltimore, which I did from, I guess, 91 until about 2003. And that was interesting.
That's the B&O Railroad Museum in Maryland. Huh?
And then most recently, I did some photography of some of the equipment. and I showed it to the chief of pediatric oncology at the National Institutes of Health. It's a friend of mine, the name of Lee Hellman. And Lee looked at my work and decided he would like me to produce a visual tour of his branch. I did, and that took about 3 months, and we finished it sometime in the middle of 2003, and it is now on the NIH website. And then I did another one for the pediatric, well, it's the Ronald McDonald House of the National Institutes of Health. It's called the Children's Inn at NIH. And children and parents who are not overly affluent can stay there at $10 a night or no cost to them at all.
And are these PowerPoint presentations,
These
Bill?
are all PowerPoint presentations.
And then a person checking into the Ronald McDonald House would have availability to look at this program.
Yes, and they're putting it on their website. I think have put it on their website.
Okay. And then what about the Holy Cross Hospital in Silver Springs?
Well, I don't know. Sometime I got all involved over there, and they opened a new emergency room, radically removed from the old one. And I did a PowerPoint program about it, and I've done one about their total joint replacement program. And I'm working on bariatric surgery, which is a separate specialty and involves shrinking the size of grossly overweight patients, shrinking the size of their stomach and giving them special feedings. And it is an interesting procedure that carries out over a number of years.
Bill, as we bring this interview to a conclusion, I'm wondering what you would tell a high school student or maybe a college student as they were wondering about maybe a career in medicine and maybe anesthesiology. What advice would you give a person like that?
I think the important thing about an anesthesiologist is total care of each individual patient on whom they are for whom they are working, carrying them preoperatively by counseling and setting aside concerns through the anesthetic into the postoperative period. And if they like doing things for people on a one-on-one basis, like bringing the latest in science and technology to these sometimes frightened individuals and helping them get through the sometimes emotionally traumatic experience of being hospitalized and operated upon, I think this is a valuable contribution to society and highly worthwhile career.
I agree. And Bill, I'd like to thank you very much for letting us have this interview today. And I'd also like to thank you on behalf of our patients and our profession for all that you've done in your career. Thank you very much.